constant thing. So today on the show, I have my guest with me. He is Dr. Ajibola Sanda, a senior registrar, Department of Medicine, LASUTH, a volunteer physician for Sickle Cell Foundation Nigeria, and he discusses the topic before us today: stem cell transplantation for sickle cell disorder. You're welcome to the studios, Dr. Santa.
Thank you for having me. Good
All right,
afternoon.
good afternoon. My name is Thelma Ellams, and this show is in partnership with the Sickle Cell Foundation Nigeria and in honor of the blessed memory of Tosi Buckner. Surviving sickle cell is a show that throws a lot of light on sickle cell, all that comes with it, all that you do not know, and all that you seemingly think to know. And we try to clear the air on a lot of these things, myths, and as you have it. So, while it's a show that is actually free for you to call in, unfortunately, you cannot call in today for obvious reasons. But be that as it may, we promise that next week, going forward, yes, we'll be live, and then you can call in to the show. But let's look at stem cell transplantation. I beg your pardon. Stem cell transplantation for sickle cell disorder. What is that about, Dr. Sanda?
Okay, so I'll try to speak in as simple terms as possible, not to confuse anybody.
Okay, thank
So,
you.
stem cell transplantation is a process by which a person who does not have the sickle cell disorder has blood taken from him.
Mm-hmm.
That blood contains some elements that we call stem cells, and it is transferred into another individual who has sickle cell disorder, but is a match with the donor. That's the person who the stem cell is taken from. And that process, what does it convey or confer? The person with sickle cell disorder now bears the genotype of the individual's blood in which he is collecting. I don't know if I
Is
should
that
go
even
over
possible?
that again. Yes.
So, are you saying that sickle cell disorder or sickle cell disease has a cure?
So stem cell transplantation is the cure for sickle cell disease. Yes. So that's the cure for sickle cell disease.
Oh, and you're saying actually that not every blood type qualifies for this, because you said you take the blood and then if you find what you're looking for.
So what we do, what I meant is this. I'm just trying to be make it simple.
Okay.
So before you can go ahead with the process,
Right.
you get two people. Most times you get two related people, so a brother and a sister. So let's say
they must be relatives.
They mustn't be relatives, but most times we use relatives. But there are situations where we can use unrelated donors.
Okay.
So what we mean is that two people, one is a donor, one is a recipient. The recipient is the individual with the sickle cell disorder. The donor is somebody whose genotype is either AA or AS, who doesn't have sickle cell. And then there are some tests that we run in both individuals to find out that if I take blood from the donor to give to the recipient, there will not be a reaction in that recipient.
Okay.
So we call that test HLA typing, which the full meaning is the human leukocyte antigen typing.
Okay.
So that test will confirm that both of them are compatible with each other. And then we take that individual's blood. Now, it's not just the blood we're taking what we call stem cells. So those stem cells, they can be harvested from different parts. One from the bone marrow. So a stem cell transplant is the same thing as a bone marrow transplant. So you can take it from the bone marrow. You can take it from the peripheral blood, which is just like taking a blood sample from an individual. But before you can do that, you would have given them some form of medication to prime their blood to produce a lot of stem cells.
That's the donor.
Yes, that is donor. So that by the time you are taking blood from him, the blood contains a lot of stem cells. Another source of stem cell is the cord blood, which is from the placenta. So we can get cord blood also from the stem cells from the placenta or from the fetal liver, so the liver of the fetus. So those are sources of stem cells. Now, by the time you have done your match and you find out that both of them are compatible with each other, you will now transfuse that stem cell. You transfuse that stem cell into your donor. But in between that process, a lot of things happen. So first of all, you want to give your donor, which is your patient with sickle cell disease, some medications to reduce their marrow, to reduce their immunity and stop their marrow from functioning properly. so that they don't produce their own sickle cell genes in preparation for the new stem cell you are giving them. So by the time you take stem cells from a patient with whose genotype was AA and you transfuse it into the sickle cell patient, he automatically becomes AA, not in genotype but in his phenotype. So what do I mean?
Tell us.
After a stem cells transplant, the patient still is genetically SS. So the genes he will transmit or she will transmit to their offspring is the SS gene. But in their appearance and their day-to-day activities and living, they would no longer express the sickle cell gene. So all the complications of sickle cell, such as the crisis, the leg ulcers, the risk of having a stroke, priapism, the acute chest syndrome, all of that will no longer manifest in that patient, because now the body will respond like as if the patient is genetically AA or whatever genotype the donor was.
So if I get you correctly, what you're saying invariably is like this individual carries two, what is it, genotype or phenotypes, or has a genotype and then a phenotype of some
Fantastic,
sort.
exactly. So so your genotype is your genome, your makeup, what you transmit to your offspring. Your phenotype is your expressivity of your genotype. So how do you express your genotype? So if you are SS, your phenotype will be, you would have crisis, you would have pains. In children, they will have swollen limbs, they will be at risk of a stroke and all the other complications of sickle cell. But if you are AA, you will not have those complications. So a patient who has had a stem cell transplant would genetically still be SS, which means he will still transmit the S gene, but his body would not manifest the SS gene anymore. He will now behave like somebody who is AA or
Okay, so
AS.
let me just ask on behalf of people whose ears are just itching to hear this part. So is there another procedure of some sort, perhaps, that can not just, phenotypically change, the genotype, but, make it extensive? Because in the end, you still have to watch who you fall for, or who you fall in love with.
Well, so in medicine and in the world of sickle cell, your genotype, you don't marry genotype, you marry an individual. I say this everywhere I go to. So I won't say, oh, I'm not marrying this lady because her father is diabetic. Diabetes is also very genetic. Or I'm not going to marry this lady because there is some form of malignancy, that's a cancer in their family. So you don't marry a disease, or you don't marry a disease condition, you marry an individual. Same thing with sickle cell. You don't marry a genotype, you marry the individual. So yes, I understand the fact that most people will come at me and say, oh, no, they shouldn't get married because they can have a child with SS
still.
But that is the place of genetic counseling. So you give the patient an informed decision. These are the risks with this decision you're about to make. Do you want to go ahead? And if the patient wants to go ahead, you give the patient options of care going forward. So we can't say because you are AS, you should. It's not a taboo, or there is no law saying you should not marry another AS. But you have to be duly informed of the risks you are going to go ahead with. You understand? So the purpose of a bone marrow transplant is to cure the individual and not to cure the marriage or whatever.
The generations after the individual.
Exactly. Yes, that is the purpose.
However, somewhat genetic counseling comes to play.
Oh yes, so genetic counseling is the cornerstone bedrock of the management of patients with HBSS.
Okay.
Every patient I manage, I've managed over 5,000. First things first is genetic counseling. So you need to understand what it is that you are either going into or you have. And when you are doing genetic counseling, you just don't counsel an individual. Counsel every other person around them. Family, friends, siblings, everybody.
Okay. Like this, if you're just tuned in, you're listening to Surviving Sickle Cell on your number one family radio 92.3 Inspiration FM. And the doctor before us is Dr. Ajibola Sanda. My name is Thelma Illams. And yes, we're talking about stem cell transplantation, yes, in sickle cell disease. So I know we went ahead immediately to talk about stem cell transplantation, but what is this stem cell itself?
So fantastic. So the stem cell is a naive cell. What do I mean by that? It's a cell that has not yet committed to any process. So a stem cell can be taken from an individual, and you can engineer it to become a heart cell. You can engineer it to become something for the gastrointestinal tract. So you can engineer a stem cell to be a committed cell. But in this process, we're engineering it to become a blood forming cell. So that is what it is committed to. I don't know if you get what I mean. So cord blood, when you take cord blood from a baby's placenta and you store it for an individual, you can use it to cure Parkinson's disease in the future. You can use it to cure stroke in the future. Because in every area of medicine now, we've gotten to the level where we've seen that everything has to do with the genetic basis. So even with stroke, we are now using some form of stem cell regeneration to help patients with stroke. And then I saw something recently, a man who had an accident and was paralyzed from the neck downwards. With stem cells, they were able to repair the part of the spinal cord that was affected, and the man is walking now. This is a patient who was told he was never going to walk again. So stem cell in sickle cell is basically the same thing. A naive cell is taken from an individual and engineered to become a bone marrow forming cell to produce the genotype from the individual it was taken from.
Can we replace naive with passive? Can
Okay,
that
yes,
work?
let's use passive.
Okay.
Okay, yes. So passive.
Okay.
So how do you, a lot of people, when they hear stem cell transplantation, they think it's a surgery.
Right.
It's not a surgery,
Per
it's
se.
more of a blood transfusion.
Okay.
So the process is
So there are more needles than knives. Can I put it that way?
there's one needle.
One needle.
Yes. So
Okay.
bone marrow or stem cell is taken from a donor,
Okay.
and the patient who's going to receive the stem cell is put in a room which is meant to be a sterile room,
Okay.
and is given some drugs to reduce his own immunity. So now those drugs will reduce his own function of his own bone marrow. Now your bone marrow doesn't only produce your red cells, it also produces your white cells.
Right.
And your white cells are your body's natural defense against infections and every other thing.
So those are your active cells.
Yes, so when you suppress the bone marrow of an individual, you're also going to suppress his ability to fight off infections. So you put him in a sterile room where he doesn't come in contact with anything that is not pure.
Okay.
Yes, and then after you have suppressed the immunity to a considerable length, you now give him what you have taken from the donor and transfuse it back into him, and the whole process is complete. What is left is now you give drugs to help the new marrow to respond in the individual and to help him from allowing his body to fight off the new marrow as a foreign organism. So this, I've tried to simplify, is a complex process. And in some parts of the world, stem cell transplantation, there is a criteria. So not every patient with sickle cell disorder requires a stem cell transplantation because it has its own complications. Yeah, there are issues that we call graft versus host disease.
Okay, so are those like side effects or
Complications. Yeah, I'll rather call them complications of the procedure, not side effects.
Okay.
Yes,
That's after the procedure.
Yes, after the procedure.
Okay.
Yes, so an individual's body can try to reject the new marrow he was given, and it can present in many forms, affecting different systems of the body. So ideally, you should only put in a sickle cell patient who has had complications from the disease, so at risk of a stroke, those who have had a stroke, those who have had an acute chest syndrome, those who have had recurrent vaso-occlusive crisis, those who have had sequestration crisis. They are the ones who fits the criteria for a bone marrow transplant or a stem cell transplant, so to speak. Or those maybe with sickle cell renal disease in which their kidney is already affected.
So my next question really would have been, is there like an age limit who actually qualifies for stem cell transplantation?
So a stem cell transplantation is better done in younger age groups. Better done in the younger age groups.
But you're talking about people having very acute complications in sickle cell disease to actually qualify for it.
Okay, so in the younger age groups, the complications of the procedure are less.
Right.
Yes, and then in the younger age group is where you find a lot of people with these acute complications. So sickle cell disease is one of the commonest cause of under 5 mortality in this region, sub-Saharan Africa. So you find out that those who usually outgrow go through these younger age stages, most times they do well. For instance, in places like America now, the average lifespan of a patient with sickle cell is 63, while the average lifespan of the average Nigerian is under 50. So, meaning that if you're a sickle cell patient in America, you stand a better chance of living longer than the average Nigerian. So, sickle cell is not a death sentence. It's a manageable condition like hypertension or diabetes. And then every day, breakthroughs in the management of these conditions are coming up. Recently, a new drug was just produced in the United States called Oxbryta, and it's one of it's the first disease-modifying drug for sickle cell disease. Even though currently the cost makes it out of reach for people who really need it, which is here in Nigeria, we have the largest burden of this disease in the world.
Right. So let's go into that, because I was really going to ask you, how affordable is it to actually
The drug or the transplants?
everything that comes with it? That
So
would
stem
make...
cell transplantation is not cheap anywhere in the world.
Okay.
In areas where you have it cheap, you can get it for as little as $50,000. Yes, that is in areas where you have it cheap, and that is when the procedure is complication free. But the good thing about it is that the Sickle Cell Foundation is bringing stem cell transplantation to Nigeria.
Okay.
And just like everything else in economics, when something is done in your own home and is locally sourced, it becomes cheaper. So hopefully when the foundation, in collaboration with the teaching hospital in Lagos, when they start the bone marrow transplants, the cost will be affordable for the average Nigerian. And since it is done at home, things that would usually take money like flights, accommodation, will be out of the way.
Okay, so you have actually rightly said that there's some persons whom, after the transplantation, their bodies could begin to react to the new stem cells in their body. So how long a time would you say is safe for such a patient, after the transplantation?
So with the graft versus host disease, it can be divided into the hyperacute, acute, and chronic. So the chronic doesn't have a timeline, meaning that the person can have the complications anytime.
Right.
Yes. So, but that is the reason why after the procedure, you are put on immunosuppressive medications to prevent this from happening. And peradventure this happens and you need treatment, there are treatments in place to check this complication.
Okay, so you're saying even after it, such a person is to come for like checkups?
Oh yes, definitely.
Stay on your medication religiously?
Definitely.
And all of that?
Definitely. But I must say that with bone marrow transplant, that's stem cell transplant, you're not on medication for life. Unlike other solid organ transplants like the kidney transplant. With bone marrow transplant, you're just on medications for a certain amount of time. After all your blood works have checked out and the patient is clinically fine, you start to tail off the medications.
So from the little I know, really, when it comes to anything that has to do with bone marrow transplant or bone marrow at all, it would seem like persons, or donors are not very responsive. So I'm going to ask you, as a doctor, from your experience, what has it been like? Do you actually find people who volunteer easily to say, oh yes, I'm willing to do this?
So for a bone marrow transplant, I'll be surprised why anyone will want to donate, because nothing is really being taken from you. You're more or less donating blood, and that's it. In fact, everywhere where people donate...
I've heard things, I'm not sure if it's a myth or if it's true, I'm not sure of it, where they say when you want to do anything as regards bone marrow, you want to take blood, the needles are bigger and it's really painful and things like that.
During the procedure, medicine has really advanced. Okay. Nobody really wants anybody to go through pain anymore. So you're going to be given medications that will make you more or less not feel anything. You won't feel anything going on. And if it is taken from a child, the child will be put to sleep. So you won't feel anything. To show you how uncomplicated donating a bone marrow, so to speak, is, the patient is discharged the next day.
Oh, really?
Yes.
That's how fit that
person is.
So
in some cases where for bone marrow, so taking sample from a bone marrow can be used for investigative and therapeutic purposes. Therapeutic in sense of you're donating. Investigative, maybe if somebody has a condition and you want to check some cells in the bone marrow. I can take a bone marrow from you now, and immediately I clean you up, you stand up the next minute and go home.
So you don't get to feel dizzy or anything like that?
No. Okay. So it is not a procedure that
A
you
do and die affair.
No, 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 no. It's not. It's
Oh,
not.
okay, so let's talk about the level of safety of
Okay.
stem transplantation in children.
So, stem cell transplantation is a complex procedure. And like other complex procedures, has its own challenges. So I'm not going to come and tell you that it's 100% safe. It's a procedure where the recipient is the one who faces 99% of the complications. Like I explained to you earlier, the only complication a donor might likely face might be pain, and you give paracetamol for that. Nothing, no big deal.
As light as that.
Yes, but with the recipients, the issue of graft versus host disease is a very big complication. In some people can be very mild from just a skin reaction, and to some other people can be life-threatening, such that the patient will need to be in an ICU. So there are also other things that can occur. This will be a bit too technical for me to go into on a radio station where 95% of the people listening are just, So yeah, there are also other complications that could occur. But in choosing your patients, you put all of these into consideration. And if the risk outweighs the benefits, most times when the person has bypassed the age of 16, which has the highest risk of sickle cell, of stroke in sickle cell, you tend to be able to manage that person with medication going forward.
Hence, you do not need a stem cell transplantation.
Exactly. But stem cell transplantation is not just for sickle cell. Also for malignancies like leukemias, lymphomas, and some other conditions, thalassemias, they would also benefit from stem cell transplantation. So sickle cell disease is just one of the conditions that would benefit from stem cell transplantation.
Okay, so what are the medical reasons, if there are any, really, why, for a transplantation or bone marrow, or however it comes, it would seem like you guys would rather advise that you go with relatives to people who are not relatives. Is there something about it?
So for a transplantation, now I'm not just being specific with bone marrow. You want to be as open as possible, so you don't want it to be commercially based. So in the sense that, so for something like a kidney transplant, you rather the donor is doing that out of free will, and most times out of free will come from relatives and loved ones. So in the process of when you now start getting people to donate for me and pay, it sort of research has been done on all of this, and research has shown that patients who get commercial donors usually don't do well in the long term, in the sense that that commercial donor, you didn't know his lifestyle before the transplantation.
And tests cannot tell that.
Tests might not be able to say how functional his organ he's giving you is. It might just tell you, okay, he's fit enough to give you an organ. So and you find out that because it's not being done out of free will, there are a lot of complications that follow. So it's usually not advised. In fact, some transplant centers are shut down if you are found out to be using commercial donors.
All right, so I'm afraid we're out of time. We have to go, but I'm going to ask you what your last words on the show would be.
So my last words on the show will be: sickle cell disease is not a death sentence. It's a manageable condition. Nigeria has the highest burden of sickle cell disease around the whole world. 150,000 babies are born each year with sickle cell in Nigeria. So we should be at the forefront of research and providing succor to patients with this condition.
All right, thank you so much, Dr. Ajibola Sanda, the Senior Registrar at the Senior Registrar, Department of Medicine, LASUTH, and Volunteer Physician for Sickle Cell Foundation Nigeria. And yes, we have discussed stem cell transplantation for sickle cell disorder and even more. The show is in partnership with our friend and partner, the Sickle Cell Foundation Nigeria, and of course is in honor of the memory of our blessed Tosi Buckner. My name is Thelma Illams. Let's do this again, same time on Saturday, 11:30. The World News is up at the top of the hour.